Good evening, everyone. It's Dr. Nicole. It is Wednesday, July 2nd. It is 7:06 p.m. and it is beautiful outside today, so I decided to come on out and do this talk on hypertension. So I'll wait just a few minutes, let some folks come on in the room. Please share this video. Tonight we're going to talk about everything you've always wanted to know about hypertension. Went to a great conference about 2 weeks ago. It was an update on hypertension and some things on the kidneys and the bladder and the prostate. I hope you checked out my video from earlier this week on Sunday about the prostate and overactive bladder. If you have any questions about that, please feel free to look up that video and share it. Get some great information about the kidneys, the bladder, overactive bladder, and prostatic hypertrophy. All right, we'll just wait a few more moments, let some folks join in. How did everybody's day go? Hopefully it was a wonderful day. It was busy for me in clinic today. Very, very busy. Very busy day. But busy is okay, because busy means people are coming in to be seen and people are getting healthier. So that's a great thing. All right, we're just gonna wait just a few more moments, let some folks come on in. Please share this video. Share with your friends. People need to know about hypertension and high blood pressure. Sharing is caring. So come on in the room. Let's see. I'm gonna wait just another moment here. I want everyone to come on in and learn about hypertension and high blood pressure. Gonna wait one more minute. Just inviting some folks in. Hey Alex, how are you? All right, it's 7:10, so we're gonna go ahead and get started. So I'm Dr. Nicole, your board certified family physician. I specialize in chronic disease management and prevention, and I also specialize in explaining chronic diseases to everyday people in understandable terms. I help pastors and parishioners and everyday people to live their best lives and transform their mind, body, and spirit so that they can be more informed and so that they can be present for their communities, their congregations, and their families. Please follow me on Facebook Live, www.facebook.com/Dr. Nicole D.O. That's DRNICOLEDO. Follow me for more information. Hey there, Miss Chapman, how are you? All right, so we're going to talk about hypertension today. It's a fancy word for blood pressure. So what is high blood pressure? Well, blood pressure consists of two numbers. You got that top number and then you've got your bottom number. So your top number is what we call the systolic number. Systolic is the amount of pressure that is in the heart when the heart contracts or when it squeezes, okay? So when the heart squeezes, it's pushing the blood out of the heart into the rest of the body. And when it goes to the rest of the body, hey Sean, how are you? That's called the systolic number. So that's the number on the top, okay? The diastolic, or the number on the bottom, is the amount of pressure that's in the heart when the heart releases. So the pressure when it contracts and the blood is being pushed out, that's the systolic. The amount of pressure when the heart relaxes is called the diastolic. Why the diastolic number is just as important is because when the heart relaxes, that's when the heart fills up with blood. And so once the heart fills with blood, hey Nikki, how are you? When the heart fills with blood, that's where you get the blood flow to be able to push out when it squeezes again. So if you have too much pressure in the heart, when it relaxes, then it can't get all the blood flow in. It can't get all the blood into the heart. So what happens when that happens? Well, that means that the blood backs up back into the venous system. So then it can cause some swelling. It can back up into the lungs, it can back up into the ankles, and it can cause edema or swelling in your ankles. If it's in your lungs, and that can cause swelling and fluid in your lungs. Okay, so both numbers are just as important. Your systolic, which is how much pressure is around the heart when the heart squeezes, and the diastolic, which is how much pressure is around the heart when the heart relaxes, okay? So both of those numbers are very, very important. I've heard some people say, oh, well, that's just the bottom number, it's not important. No, 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 that's not true. You need to have a good systolic and diastolic number, okay? So 1 in 3 people have elevated blood pressure readings. So it's very important to know if you are one of those 1 in 3 people. It's very important. Why does blood pressure matter? Well, high blood pressure can lead to heart attacks. It can lead to strokes. It can lead to problems with the kidneys. It can lead to problems with the glands. It can lead to heart attacks, strokes, problems with the kidneys, problems with the glands. Eventually, if blood pressure is not controlled, it can lead to blindness. So it's very, very, very important to control your blood pressure, okay? So what does that mean? What is the definition of high blood pressure or hypertension? So a normal blood pressure is when that systolic, that's that top number, is less than 120, okay? And then the bottom number needs to be less than 80. So I hear people say, oh, my blood pressure is low if it's running in the 100s or 110s on the top, or running in the 60s on the bottom. No, 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 that's not low. That's actually where we want it. We want you to be between 100 and 120 on the top, and on the bottom we want you to be between 60 and 80, okay? So that's a normal blood pressure. Then there is pre-hypertension. That's when your top number, or your systolic number, is between 120 and 140. And then there is the bottom number would need to be between 80 and 89. So that's pre-hypertension. When you're pre-hypertensive, that means you still have some time to do something about it to hopefully prevent it from becoming full-fledged hypertension. The stage 1 hypertension is when your blood pressure on the top, that systolic number, is between 140 and 159, and your bottom number is between 90 and 99, okay? Then stage 2 hypertension, that's when we're starting to get real concerned here. Well, we're concerned all the time, but very, very concerned. Stage 2 is when that systolic, or that top number, is above 160, and when that bottom number is above 100. Okay, let me just run through those numbers one more time. I just threw a lot of numbers out at you. This is where it's good to have some graphics. Next time I will do that. Or I'll post some in the pictures. So if anybody wants to write that down, they can. So a normal blood pressure, the systolic is less than 120, the diastolic is less than 80, the pre-hypertension is between 120 and 140 on the top, and 80 to 89 on the bottom. Stage 1 is between 140 and 159 on the top, between 90 and 99 on the bottom. Hey Trey, how are you? And stage 2 is greater than 160 on the top and greater than 100 on the bottom, okay? So that is what is hypertension. So different types of hypertension. There are multiple types of hypertension. The main one that most people have heard of is primary hypertension. So primary hypertension occurs basically 80 to 90% of people have primary hypertension. And that's when I said maybe the 1 in 3 people have the hypertension. So there are hypertension risk factors that make you more at risk for having hypertension. If you have a family history of hypertension, then you have a higher chance of being hypertensive yourself, okay? These are what we call the unchangeable risk factors. So you can't change your family history. So if mama had it, if daddy had it, if grandma and grandpa had it, then you're at a higher risk of having it yourself, okay? So family history is a big risk factor. As we age, our blood vessels tend to get more plaque in them. They tend to get a little stiffer, and so the blood pressure can go up and you can be higher. Hey, Terica, how are you? Thanks for showing up tonight. So the older we get, the higher our blood pressure can be, okay? Race. We do know that African Americans and Hispanic Americans tend to have higher blood pressures than our Caucasian Americans. Hey, Joseph, how are you? Thanks for joining in tonight. And some Asians can also have higher blood pressures. Now, that's not to say that if you are Caucasian that you're not going to have higher blood pressure. You can have it just as well. Remember, I said 1 in 3 people have elevated blood pressure. So, but there are some races that have higher numbers than other races. If you have certain other disease factors like pregnancy can make you have some elevated risk factors for hypertension as well, okay? Now, there are some changeable or risk factors that you can control. So one of the main ones is how much sodium are you bringing in and how much salt are you ingesting, okay? And there's salt in everything just about that we eat, especially in anything that is preserved. Hey, Dr. Sam, how are you? Thanks for joining in. So anything that's preserved, so whether that be a canned vegetable, has a lot of sodium. It's the sodium that preserves the food that makes it able to last a long time. So also your canned or your packaged meats, so your lunch meats, your ham, your turkey, salami, anything that's packaged, you know, that film, that kind of salty liquid that the meat is packaged in, that's sodium. It's a high sodium content. That's what makes it preserved. That's what keeps it fresh, okay? So if you are going to eat your lunch meats, what you need to do is go and get it freshly sliced. It's not, you notice that doesn't last as long because it doesn't have as high of a sodium content, okay? Other things that are high in sodium content, the stuff that we cook with. So check what your seasonings that you're using. If you're using anything, of course, that says salt, so garlic salt, onion salt, those onion packets, they're tasty, but they are high in sodium. So I believe one onion soup salt packet that I've seen a lot of people cook with has 1,800 grams of 1,800 milligrams, excuse me, of sodium in it. And really, there's a 2 gram a day limit that you should really try and limit. So if you're using one of those onion soup packets and that has 1,800 milligrams, you've basically got your sodium. That's all you should be taking in for the whole day, okay? So sodium definitely is a risk factor that you can change, that you can help to lower your blood pressure. Alcohol use is another one. We know that the more alcohol you drink, the higher your blood pressure can be. Now, they have said that, you know, a glass of wine a day helps to lower the blood pressure, and that is true. Hey, Jessica, thanks for joining in tonight. Hey, Randy, thanks for joining in. That's my old piano teacher, y'all. That's who taught me how to play the keys. Thanks for joining in tonight, Randy. Good to see you. All right, so lack of physical activity is another major risk factor. So the more sedentary you are, the higher your blood pressure is going to be. All right. If you are a smoker, then your blood pressures can be higher. If you have a lot of stress going on in your life, there's, you know, stress at work, stress at home, stress with the kids, you can have higher blood pressures. So we got to lower our stress levels. All right. So those are changeable risk factors. And I will go over those again before we're done, because those are the things that we're going to really focus on to help to improve the blood pressure on your own. Okay. So again, the primary hypertension, those risk factors that affect primary hypertension, there are the changeable risk factors, and then there's the ones that we can't change, unfortunately. Okay. Hey, Dr. Portia, how are you? Thanks for joining in tonight. All right, so there's other types of hypertension. There is secondary hypertension. And that's where your high blood pressure is coming from another reason. So what are some of the secondary types? There are, if you have kidney disease, then that can cause, hey Corey, thanks for joining in, good to see you. If you have kidney disease, then that certainly can cause you to have hypertension, as well as that plays both ways. Hey there, Miss Barbara, thanks for joining in. So hypertension can cause kidney disease, and then the kidney disease can also worsen hypertension, okay? So thyroid disease, if you have elevated thyroid levels or even underactive thyroid levels, that certainly can, hey Crystal, thanks for joining in tonight. That certainly can make your blood pressures higher as well. There are certain medications that you can take. So you might be trying to treat something else, and unfortunately it has the side effect of making your blood pressures elevated. So you need to watch what medications and your doctor should go over that with you. If that is going to be something that raises your blood pressure, then either they need to consider trying something else or also treating the blood pressure at the same time that you're on that medication. One of those medications is oral contraceptives. So if you are on a birth control pill, that certainly can raise your blood pressure up, okay? And that's why a lot of our family doctors and gynecologists, before they will prescribe oral contraceptives, they will check your blood pressure, and if your blood pressures are elevated, they might not put you on the blood pressure, the birth control pills that have estrogen in them. They might just do a progestin only birth control pill, okay? There are certain tumors that can cause elevated blood pressures. There are sleep disorders that can cause elevated blood pressures, such as sleep apnea. So if you have sleep apnea, if you snore, if you are one of those people that when you're sleeping and you wake yourself up and you stop breathing while you sleep, if you're tired throughout the day, these can be signs for sleep apnea. It's very important that you go and you get your a sleep study to get checked, because when you have sleep apnea, you're not getting as much oxygen to into your blood, and so what your blood will do, your blood vessels will constrict to slow down the flow of blood, okay? When the blood slows down, then it can extract more oxygen. Well, when that constriction happens though, it makes your blood pressure higher, because then your heart has to push against those constricted blood vessels. So if you have sleep apnea, or if you have problems with your sleep and you're not getting enough oxygen, then you definitely can have higher blood pressures. A lot of times when I've got patients on 2 and 3 and sometimes 4 blood pressure pills and their blood pressures are still elevated, my next step is to look at a sleep study to see if they have sleep apnea, because if they do and we can get them on some extra oxygen when they sleep, then that helps to bring down their blood pressures. So if you have any of those symptoms that I just listed with sleep, that's snoring, waking up feeling tired, that's stopping breathing when you're sleeping, shortness of breath while you're sleeping, please go and get a sleep study to see if you have sleep apnea, because that definitely can contribute to high blood pressures, okay? There are other medical conditions such as adrenal tumors or Cushing's, which are endocrine problems that can cause elevated blood pressures as well. Other types of hypertension, there really is something called white coat hypertension. With white coat, hey Erica, how are you? Thanks for joining in tonight. White coat hypertension is truly people whose blood pressure numbers are normal at home, and then when they get to the doctor's office, they're kind of nervous or they're scared, and because of that, their blood pressures go up when they come to our office. So how we can determine that, because I've got a lot of patients who say, oh, it's just up because I'm here and I'm nervous. Well, there are 24-hour blood pressure monitors that we can hook you up with, send you home with, and it can truly read what your blood pressure is really doing at home. And then if we see that, yes, your blood pressure is normal at home, it's only when you come in the office, then we might treat that a little bit differently, and not possibly jump to putting you on medications. Then we would just do lifestyle, of course, modifications for that. I have a patient currently, I promise you, in my office, his blood pressure is always in the 200s systolic and always in the 100s diastolic. We hooked him up to one of those monitors, and he had normal 100, 110 blood pressures at home. We were like, wow, he truly had white coat hypertension. All right, so other types of hypertension, that's when the blood pressure is elevated in other areas of the body. So in your eyes, that's called ocular hypertension. In your brain, that's called intracranial hypertension. In your lungs, that's called pulmonary hypertension. So there are other areas where the blood pressure can be elevated, and you would have symptoms specific for those organs. All right, so those are the different types of hypertension. So again, real quick, there's primary hypertension, and that's just when you have high blood pressure, okay? And 90% of people have the primary hypertension. And then there's a secondary hypertension where it's another cause, another medical condition that's causing the hypertension, okay? And then there's white coat hypertension, where it's only high in the doctor's office, and then there's hypertension when it's affecting other areas of the body. All right, so how do we diagnose hypertension? So diagnosis of hypertension technically is, hey Misty, thanks for joining in. How's that beautiful baby of yours? Thanks for coming tonight. The true diagnosis of hypertension is done over some time, and we want to get at least 2 readings that are elevated on 3 separate occasions. Okay, I'm gonna say that one more time because it's kind of confusing. So 2 elevated readings, so we can do either 1 in each arm, we could do 1 standing, 1 sitting, or 1 sitting, 1 lying, or 2 different readings, and then on 3 different days. So if you have elevated readings on 3 different days, then you have met the diagnosis for hypertension. Okay, so how do we test for hypertension? With the blood pressure cuff. We do know that those home cuffs, the ones that go around your wrist, they're not quite as accurate as a true blood pressure cuff, a manual cuff that goes on the arm. And then even the automatic cuffs that go on the arm are also not quite as effective. They're great for monitoring, but we like to make the diagnosis with the manual cuff. Okay. Some things that you can do before you get tested for your blood pressure is limit your caffeine. So don't drink your cup of coffee before you go to the doctor, because the cup of coffee can raise your blood pressure. You want to not smoke because smoking, again, raises your blood pressure. You want to be seated. And I like to have my patients sit for about 5 minutes quietly, no talking, because talking or being stressed or running in the office late, those are things that can raise your blood pressure. So I like to have my patients sit for 5 minutes quietly before I test their blood pressure to see, get a true read of their blood pressure. Hey, Dr. Angie, how are you? Angel, how are you? Thanks for joining in tonight. So we want you to be quiet. We want you to have your feet sitting on the floor, not crossed. We want to put the cuff on your arm. We want to take a reading. We write down that reading, and then in the case of diagnosis, like I said, we want 2 readings, so we might do the other arm as well. Okay, so that's how we get a true blood pressure reading. We do know that different times of the day can change your blood pressure readings, so we don't just go off of one reading or off of one time. So we do like to look at different numbers. So we want to see sometimes what it is in the morning, what it is in the afternoon, what it is in the evening, and that's again where you can wear one of those monitors that can test you all day. All right, so that is how we test for blood pressure and hypertension. And so let's talk about the things that you can do to help to lower your blood pressure naturally. Okay, we talked already a little bit about lowering your sodium intake, so cutting out salt, limiting your canned vegetables, limiting your the packaged meats, limiting how much salt you're actually pouring onto your food, how much salt you're cooking with, how much salt is in things like potato chips or popcorn. So you want to limit your salt intake. That's the #1 way that you can help to lower your blood pressure. Eating a healthier diet, so more fruits, more vegetables, more natural things. We know that that can also help to lower the blood pressure. Limiting your alcohol, again, can lower your blood pressure. We do, like I said, know that they say a glass of red wine can help with cardiovascular risk, but in general, ingesting too much alcohol can increase your blood pressure, okay? you want to manage your weight. We do know that weight loss can help with managing your blood pressure and get better numbers. And then we want to see some exercise. So what we recommend is 30 minutes of cardiovascular exercise at least 3 to 4 times per week to help manage blood pressure. We also have found, studies have found that if you do 30 minutes 5 days a week, then that can lower your systolic blood pressure by at least 10 points. Okay, so 30 minutes of cardiovascular exercise 5 days a week can lower your blood pressure. It's been proven. All right. We also know that cutting out smoking, again, can help to lower the blood pressure. And a big one is to manage your stress. Okay, we are one human being, but we are made of 3 parts. We have the physical, the mind, body, and spirit. So if your mind is ill, if you've got a lot of stressors going on, if you've got just a lot that you're dealing with, that can definitely raise up your blood pressure. Okay, and that's been a proven fact. The more stressed you are, the higher your blood pressure can be. All right. So we put all that together. What do we say? So if you're found to have high blood pressure, whatever kind, the primary, the secondary, if you're found to have high blood pressure, you've tried the lifestyle modifications, you've tried to bring it down on your own, and you're still getting those elevated readings, excuse me, then you go to see your doctor, and there are multiple treatments that we can try. We start off with medications. The most common medication that we start off with, hey, so Rosalind, how are you? Thanks for joining in tonight. The first medication that we like to put people on is a diuretic. That does mean that you're going to urinate. We do still want you to take it, though, every day. And that's the most common for the either the pre-hypertensive or the stage 1 will put you on a diuretic. There are multiple classes of antihypertensives. There's ACE inhibitors, there are ARBs, which are angiotensin blockers. Those work on the kidneys. There are calcium channel blockers. Those work in the heart. There are beta blockers. Those help to slow down the heart rate and lower the pressure in the hearts. So there's lots of different types of medications that you can be on. One of the biggest things that I want as a takeaway that I want to give you, though, is just because your friend is on one blood pressure pill does not mean that that pill might not be right for you. So go to your doctor, let your doctor determine what is the best blood pressure pill for you, and then don't look at the number. So one blood pressure pill might only be 20 milligrams. Your blood pressure pill might be 100 milligrams. It doesn't mean that yours is any worse than another. It might just be in a different class. I've had patients come to me saying that their pill was too strong because their number was higher than their friends. Well, you can't really compare, because it might be different classes. So I just wanted to really put that point out there. Let your doctor take care of your blood pressure. Don't go off of what your friends say or what your friends' numbers are, what your friends' blood pressure pills or milligrams are. Really let your doctor take care of your blood pressure, okay? So once you get started on the medications, please, please don't stop taking them, okay? I have a lot of patients that come to me and they say, oh, my blood pressure is normal now, so I can stop taking the pills. No, your blood pressure is normal because you're taking the pills and it's brought your blood pressure down. Once you go off the pills, your blood pressure most times, 9 times out of 10, is going to go back up. So please don't stop taking the blood pressure. Now, if the doctor put you on the blood pressure and then you change your lifestyle, you do the risk factors that we discussed, you're exercising more, you're eating right, you're limiting your alcohol, you stopped smoking, you've lost some weight, you're managing your stress, you've lowered your sodium, then what your doctor can do is start to wean you down off the medications. But please, 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 I urge you, let your doctors wean you down, okay? Let your doctors do that. All right, so one more thing. What are some myths about hypertension that I've heard in my office? Oh, there's quite a few. One that I love hearing is, I'm just going to take some apple cider vinegar and some water and that's going to lower my blood pressure. No, it won't. It may help, but that's not how we manage blood pressure, all right? So no apple cider vinegar and honey and water. That's not going to manage your blood pressure, okay? So please don't believe that. I've heard some other folks also say that by soaking their feet in hot water, that manages their blood pressure. Also not true. It can help to lower it temporarily, but it's not going to actually manage the high blood pressure. I've heard people say that, if they it's only because they take their blood pressure at a certain time that it's elevated. Well, yes, it can change throughout the day, but if it's high, you know, most of the time, then that means we need to treat it. All right. So let's wrap this up. Blood pressure, that top number is the systolic number. That's how much pressure is when the heart squeezes. The diastolic is how much pressure when the heart relaxes. We want that top number to be less than 120, the bottom number to be less than 80. And if it's above that, then I want you to go to your doctor so that you can start with treatment. There are the different types of blood pressure. There's the primary, the secondary, and then there's the causes from other things. The diagnosis is elevated readings on 3 different occasions, on 3 different days. How do we test for blood pressure? We do like to get the manual read on 2 different arms oftentimes. Like I said, if you have a wrist cuff, that's okay. That's great for monitoring, but we don't necessarily like to make the diagnosis off a wrist cuff or off the manual cuffs. Off the automatic cuffs. We do like to use the manual cuffs. When you do test, like I said, try to not have drink caffeine. Don't smoke before you take the test. Try not to be stressed before you take the test, and don't be running into the doctor's office late before you take the test as well. You want to be seated with your feet planted on the floor, legs uncrossed, quiet, and like I tell my patients, think happy thoughts. And then we'll take your blood pressure. All right. Natural treatments, like I said, to help lower the blood pressure: cutting out your salt, exercising 30 minutes 5 days a week, managing your weight, stop smoking, limiting your alcohol, managing your stress, eating more healthy fruits and vegetables. Those are the ways that you can help to manage the blood pressure on your own. And then medications. If your blood pressure is elevated, please go to your doctor, get on a medication, and please take your pills every day. And just because the blood pressure has come back down to normal doesn't mean that you can stop taking your pills. Hey, Dr. Crystal, thanks for joining in. All right. So, does anybody have any questions about blood pressure, any myths? Go ahead and type it in the comments and we can answer those. Let's see. On my iPad here, it's not... Let me see if I can do this on my phone, because it's not pulling up my comments. All right. Well, if you do have comments later on, go ahead and write them in the questions later on. Write them in the comments. It's not pulling up on my iPad here, but I will go ahead and answer those later. So I hope everyone learned something about hypertension tonight. And thank you so much for joining. Again, I'm Dr. Nicole, your board-certified family physician. I specialize in treating and preventing chronic medical conditions and educating people about those conditions in understandable terms that they can understand, okay? I do help pastors and congregations and everyday people to live their best lives and impact their mind, body, and spirit so that they can have a greater impact on their congregations, their communities, and their families. All right. Please join me on Facebook, www.facebook.com/Dr. Nicole D.O., DRNICOLEDO. And thank you so much again for joining me tonight. Please look out for my weekly sessions on Sunday afternoons at 3 p.m. where we're going to go over just some general topics, medical topics, and I'm going to help you explain them to you in terms that you can understand. All right. If you have any questions, please feel free to leave them on my page, Dr. Nicole D.O., and I look forward to seeing you guys soon. Thank you so much for joining me. Have a great night. Bye-bye.